Understanding Attention Deficit Hyperactivity Disorder: Symptoms, Causes, and Management. The condition more commonly referred to as ADHD is a multifaceted neurodevelopmental condition that manifests in children and often persists into adulthood. It's characterized not just by the well-known symptoms of inattention, hyperactivity, and impulsivity, but also by a diverse range of behaviors that can include difficulty in organizing tasks, managing time effectively, and social challenges. These symptoms can lead to academic underachievement, workplace struggles, and interpersonal issues. ADHD's intricacies are as diverse as the individuals it affects, making it a condition that encapsulates a broad spectrum of experiences and requires a nuanced understanding. Causes. The underlying causes of ADHD are complex and multifactorial, with evidence pointing to a combination of genetic, environmental, and developmental factors. Genetics plays a pivotal role, as ADHD tends to run in families, suggesting a heritable component. Neuroimaging studies have revealed structural and functional differences in the brains of those with ADHD, particularly in areas that regulate attention, impulse control, and activity levels. Environmental factors, including prenatal exposures such as maternal smoking or alcohol use, low birth weight, and exposure to environmental toxins like lead, have been associated with an increased risk of developing ADHD. Additionally, psychosocial elements such as extreme early adversity or sustained stress may also contribute to the condition's onset. While no single cause can be identified for ADHD, the interplay between genetics, brain function, and environmental factors suggests that ADHD is a result of several converging influences that affect the brain's development and activity. Understanding these factors can be critical in identifying potential strategies for prevention and intervention. Symptoms. The symptoms of ADHD are multidimensional and extend beyond the core symptoms of inattention, hyperactivity, and impulsivity. Individuals with ADHD may struggle with executive functions, which can result in challenges with organizing tasks, prioritizing responsibilities, and managing time effectively. There can be forgetfulness in daily activities, difficulties following through on instructions, and a tendency to lose items necessary for tasks and activities. Hyperactivity may present as fidgeting, an inability to stay seated, or excessive movement in situations where it is not appropriate. Impulsivity can manifest in hasty actions without thought for consequences, interrupting conversations, or an inability to wait one's turn. These symptoms can significantly impact educational, professional, and social interactions, and vary greatly from person to person, with some experiencing mild symptoms and others facing severe disruptions to their daily life. Types. ADHD can be categorized into three primary types: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation, which involves a mixture of inattentive and hyperactive impulsive symptoms. The type of ADHD diagnosed can influence the management approach and is essential for understanding how the condition affects each individual. Management. Managing ADHD typically involves a combination of medication, psychotherapy, education, or training, or a mixture of these. Stimulant medications are often prescribed to help improve concentration and decrease impulsiveness and hyperactivity. Behavioral therapies aim to change behavior, and educational interventions are designed to provide support in academic settings. Living with ADHD is a journey that involves managing symptoms that can change over time. Successful management often requires a comprehensive approach that includes behavioral strategies, lifestyle adjustments, and support from family, educators, and healthcare professionals. Recognizing and embracing the strengths of individuals with ADHD, as well as providing support in areas of challenge, is key to living well with the condition. Thanks for watching. If you found value in this video, please leave a quick like as it helps out the channel. Don't forget to subscribe to join our health-conscious community.